Okay, chapter 43, anti-malarial, anti-protozoal, and anti-helminthic. Um, Malaria is what we consider the most significant protozoal disease in terms of morbidity and mortality. In the world, there are 3.5 to 5 million people that are infected with malaria, with an annual death rate of 1 to 2 million people. Geographic areas, again, you can kind of see them on that image of the world. That red section right in the middle where it's the hottest across the equator is really where we see the highest prevalence of malaria in that sort of sub-Saharan Africa, Southeast Asia, Latin America. Again, those warm areas across the equator. Only about 1,200 cases of malaria are actually reported in the United States annually, and mainly it's because people are getting treated or taking their anti-malaria drugs while they're traveling. Again, malaria is transmitted by the bite of an infected, very specific adult female anopheline mosquito. It can also be transmitted by infected individuals via blood transfusion. It can be translated from mother to infant prenatally and from infected needles by drug users. So again, it's blood to blood. This is an excellent YouTube video, and I would like you guys to watch it as far as how the vector, the plasmodium, is translated from human or from mosquito to human vector, which is the first vector, to the next mosquito that might bite you and suck your blood and then become infected with malaria. Okay, from the previous slide, the YouTube clip, got a little hung up on that. Again, when you're watching it, don't get so caught up in the verbiage of the type of transmission or the type of cell that you're dealing with, but really just try and watch how that malaria is being translated, how it morphs as a parasite within the human body, how it invades the cell, changes the cell, and keeps moving forward. Again, those kind of classic signs and symptoms. Definitely make sure that you read that out of the textbook. Chills and rigors, followed by fever and diaphoresis, leading to fatigue and prolonged sleep, and then it repeats itself. Some other common symptoms are headache, nausea, and joint pain. Those are some of the early signs and symptoms. There's some folks that come from those areas or prolific areas that have actually come through our nursing school, and they say, and they have shared that headache, nausea, and joint pain are some symptoms of malaria. Signs and symptoms. Again, those classic, if they feel that, they will go to their medicine cabinet, joint, muscle pain, and take their prescribed anti-malaria drugs. So interesting how in some parts of the world headache as well. Very common. Drugs that we provide, or as far as Western medicine, are really only effective during the asexual cycle. So the asexual cycle occurs in humans, and that's why our drugs are effective then. We're not actually trying to feed mosquitoes medications to stop the malaria, although they do spray for mosquitoes at large. It's not the same type of drug that we're ingesting. Again, treatment is guided by obviously understanding that the Plasmodium species is the infected, or is that what you're infected by. The clinical status of the patient, so what kind of phase they're in, what kind of cycle they're in, and how well their body is managing those phases. and then the drug susceptibility of the infecting parasite, and kind of where in the world you are in relationship. So again, very specific as far as where you acquired it, which might help with the Plasmodium species that you're dealing with, and therefore the drug treatment. You're going to attack again that parasite during the asexual phase. Again, the asexual phase is considered when that plasmodium is within the human being. The erythrocytic phase, so when we're talking about the red blood cell specifically, that's when we give our chloroquines, our hydroxychloroquine, our quinine, all that kind of good stuff. If you think about historically, again, kind of a history buff, but if you think about kind of maybe mid 1700 or 1800s to the turn of the century, as far as 1900s, and when there was a lot of exploration by England into some of these sub-Saharan areas, whether it's some sub-Saharan Africa or East Asia. One thing that they brought with them was their gin and tonic, and quinine is in tonic. That's what gives it that kind of bitter flavor. Quinine is one of the treatments for malaria. So many of the English people that traveled to these hot places to do adventure or whatever it might have been were able to survive malaria because of their gin and tonics. Interesting, yes. And again, primaquine kills parasites in either phases. Maybe used together with sulfonamides. We talked about sulfonamides as one of our antibiotics for synergistic or additive killing power to that Plasmodium species. And again, we're getting all this information not only out of the text, but from cdc.gov as far as most current, up-to-date malaria drug treatments and outbreaks, quote-unquote outbreaks. We want to be cautious about primaquine with arthritis or any sort of immunocompromised or autoimmune type of disease state. Can also be used with caution in patients that have enzyme deficiencies. It can also cause tinnitus, and you have to be careful with quinine and pregnancy. Also, just general nursing considerations, again, for our major metabolizing and excreting organs, renal and hepatic, as well as, again, because we're dealing with the erythrocyte and the hematological dysfunction. We talk about protozoal infections. Protozoas are, I could show you lots and lots of images of protozoas. I encourage you to Google protozoa types of infections. If we, as in the Western world, specifically the United States, definitely don't deal with protozoa infections as frequently as the rest of the world, due to food regulations, processed foods, and just perhaps, I don't want to say awareness because that has nothing to do with it, but just kind of how we live as Americans. We just have less infections from protozoa. But remember, protozoas are parasitic in nature, so they are living off whatever human and or animal species they have infected, and it develops from just a single organism, which is pretty amazing. So we can obviously assume that people that have an compromised immune system would obviously be more at risk. We talked about that in relationship to HIV and AIDS as far as opportunistic infections and protozoal infections. Also, patients with any sort of blood compromisation, like a blood cancer, like leukemia. Again, we rely on our blood products to help with our immune system, and when we have these immunocompromised disease states, we are now at a risk for those protozoal and parasitic type of infections. Some transmission is either person to person or any sort of ingestion of the contaminant, whether that's food or water. You can also have direct contact with the parasite. an insect bite, for example, being transmitted from a mosquito and or a tick, just like we saw in malaria. Um, so amoebas or giardias, pneumocystis, toxoplasmosis, and trichomoniasis are examples of some of our more common protozoal infections. There is a link below if you would like to just look at some of these. Again, you can Google any of the terminology on the right. The amoebas, giardias, pneumocystis, toxoplasmosis, and trichomoniasis, and you can see what these actual protozoa look like, and how we get them and how they are transmitted. Definitely very important for lots of, again, immunocompromised, elderly, and the young, and pregnant and lactating. Some of the drugs that we give, again, we can kind of see that crossover as far as sometimes a very specific treatment for malaria and or non-malarial type of protozoal infections. Anti-helminthic or anti-worm. I purposely do not show images here. I have found many, many images of worms online, and kind of just generally freaks me out. Fascinating without a doubt. Thankfully, we don't have a ton of worm infections here, but the ones on the right, the tapeworms, roundworms, flukes, and flatworms, are all very predominant and can be found locally. But unlike the protozoa, worms are actually very large and have very complex structures, as you probably know if you've ever been in anatomy class and done a dissection. And again, when we treat worms, we use a very specific medication for the worm. So we have to know the worm to give it its specific drug treatment. So very important that we identify the causative worm. That's essential. And how do we do that? Well, sometimes we can find the worm ova or larvae in feces, urine, blood, sputum, or other local tissues. So again, got to find the worm to find out how to treat it. Again, if you do look online, I'm fascinated to hear what you think. More drug therapy. Pyrantel or Pinax, pinworms. Pinworms are found a lot in pediatric patients, and you will see a little one and they kind of keep scratching their bottom, and you're like, why do you keep, what's wrong with your butt? Kind of thing. And they might go to their primary care, they might go to the ED, whatever it might be, and they'll actually kind of spread the cheeks apart, take a piece of tape, put a piece of tape over the anus and pop it off, and look at that under just light, and you can actually see if a pediatric patient has pinworms. You can see them on the tape. Fascinating and gross and real. So again, now we know that it's a pinworm, so now we know that we can give it Pyrantel. It is the only anti-worm drug available in the United States without a prescription, and mainly it's because it's easily identified using the tape method. Definitely nursing considerations for all of these, but for sure baseline as far as where have you been and how were you potentially exposed. So from malaria to other protozoa to worms, we have to figure out where you've been to see what you've been exposed to appropriately give you the correct medication. Again, make sure that you've reviewed in your text some of those common signs and symptoms of malaria. And then what are some common, again, protozoa? Who is most at risk? So our immunocompromised, our young and old for protozoa. And it's, again, we have to have come in contact with that protozoa. So where we kind of get those or find them. And then lastly, our worms and how we medicate against worms is finding out what kind of worm you have. Again, Pyrantel for pinworms is the only one over the counter. And always, again, getting that good history of medication, keeping yourself safe in the collection of it all. obviously baselines, and then making sure that as we start providing medication, that we are monitoring for any side effects, adverse effects, and potential drug-drug interactions.